Yeah, now we go into the important concept, that is treatment assignment. Yeah, we have seen that every patient should be assigned to a treatment group, right? So now we see what are the ways and what are the various variants, how we assign the treatment group to a patient. Okay, and what is treatment assignment? Treatment assignment is assigning the subject to a treatment group or assigning the treatment group to a subject. Okay, here is a subject, here is a treatment group. Okay, you can say you can assign subject to a treatment group, or you can assign treatment group to a subject. Both are same. Basically, we are assigning the subject to a treatment group. That is known as treatment assignment. Now we will check what are the different types. Okay, there are various methodologies of classification. One of the important one is enrollment and randomization. These are the basic ones. You have to understand what is enrollment and what is randomization. I hope you have remembered the concept of selection bias. Yeah, selection bias is the bias or the preformed opinion, or pre-interpreted opinion by the person who is assigning the treatment group. For example, there is an investigator. This is an investigator. Investigator is normally a doctor. Okay, there is a doctor at a site, and one subject we have enrolled into the clinical trial, and this is the patient, or this is the subject. For example, there are two treatment arms. One is active treatment arm and placebo treatment arm. Active treatment arm means there will be original drug. Okay, placebo treatment means this is a dummy drug. There is no medicine in this drug. If there is a relative of the doctor, what he thinks is, I should be keeping this my relative. So I want to, I love my relative and I want to keep him on the active drug. I don't want to give the dummy drug. So what doctor does is he will put this person into the active treatment arm. Okay, or if the doctor, on the contrary, if the doctor doesn't like his relative and he wants to cause some harm to the relative, he thinks that I don't want to keep in the active drug, I will give him the dummy drug and he will push him to the dummy drug. This is a problem. If we allow the doctor to decide, or the investigator to decide to select the treatment arm, then there will be a bias that is known as enrollment bias. This enrollment is the bias that occurs during enrollment of the patient into a treatment arm, is known as a selection bias. Okay, keeping this in mind, so how do we remove this selection bias? That we look now. Now you can see here, if we give, this is the important word here, if we give the choice to the investigator to select the treatment group, then that becomes enrollment. If investigator is given a choice, if we, in the system we have designed the system in such a way that investigators can select the treatment group for a particular subject, that is known as enrollment. Okay, if there is enrollment in the treatment in a particular clinical trial, you cannot eliminate the selection bias. Okay, now how do we eliminate the selection bias? To eliminate the selection bias, there is a process known as randomization. How randomization is done? By chance. We remove this choice and give the introduce this choice. Then who decides the treatment arm to the subject? The system decides. The IRT system, or clinical interactive response system, decides to which treatment arm we have to push the subject. Then that is known as randomization. If it is given to the system, if that privilege is taken out from the investigator and if it is given to the system, then that becomes randomization. Randomization eliminates selection bias. If you introduce randomization into a clinical trial, it eliminates the selection bias. While randomization, system will assign the treatment group, but in enrollment, investigator is given a choice to select the treatment group for a particular subject. That is the main difference between enrollment and randomization.
ClinGenius Research.